like these.
Why not start the show off with the best thing? And they're filled with
Green tea. What kind of
coffee.
Green tea? Coffee. Shit.
Just kidding. Green tea. Oh, matcha green tea. Organic matcha green tea from Costco. Or the
Only $19.99?
good enough for government work.
Cool. Do we have a discount code for them?
No.
Well, then why are we mentioning it? See, we're getting free sponsors. There's no free lunch.
It's a health benefit.
Yeah.
It's a value add.
Yeah, that's true. Value add. So,
And
green tea.
Yes. Very good. And I drink it strong, and he's drinking it strong. And we have our collagen in there.
Yep. Dr. Axe, multi-collagen.
Don't have to buy his brand, but that's what we buy. Excellent.
Hey, everybody. Welcome back to Coffee with the Doc. I'm No Excuse Charlie with, of course, the Doc.
Dr. Ryan Livingston here.
Hey, how about these fancy new mugs we have? I like these.
Why not start the show off with the best thing? And they're filled with
Green tea. What kind of
coffee.
Green tea? Coffee. Shit.
Just kidding. Green tea. Oh, matcha green tea. Organic matcha. How's the feedback?
Good.
Good.
Feedback has been positive. People have been asking me all types of questions about how they can submit them, and lo and behold, I did not offer them an avenue to do that this time. So, if you have any questions, we will be sure to post different avenues, so to speak, for you guys to submit your questions. Anything on health, anything on performance, anything on nutrition, spinal care. We even do business, financial, all that sort of stuff. That's more in his wheelhouse, but regardless, I'm here to provide jokes and look pretty on camera, I guess.
Yeah.
Okay, so what do we got on tap for today?
That's a great question, Charlie. I was hoping you would know that answer.
Well, I'm looking at my slate, and your slate looks much more filled than mine.
So, the first thing I wanted to talk about was a question that I often get from my patients, or rather, soon-to-be patients, skepticism. I wanted to address that. And in the bodybuilding world, in personal training, since it's like established in the common, we'll call it the common lay knowledge of fitness arena, someone could come up to you, and if you are, would you believe that they're going to be more likely to take advice from you if they want to build muscle? That's their goal. They either want to get fit, or they want to get lean, or they want to build muscle, or even athletes who want to get performance, even though you can't see performance per se.
Yep.
Why would they be, I'm setting you up for this question, but why would they be more likely to listen to you than somebody who doesn't look in shape? Kind of gave the answer away, but.
Yeah, I think that, so I've had this discussion a lot with people where, specifically to personal trainers, where there's two areas that you need to be proficient in. Number one would be the knowledge base and the academia. Like, you need to understand, like, you know, the science, so to speak, behind everything. You need to understand the ins and outs of how the body functions, the anatomy, the physiology, all that stuff. Well, then there's the other side of it too, which is like the anecdotal experience, like the in the trenches work, so to speak, where you look the part because you've done the part. Either you've been an athlete in you know, your past, or you look athletic and look in shape. And now we talked about on an earlier episode how looking in shape and being in shape, or looking healthy and being healthy, can be two entirely different things. But more often than not, if you look the part, people are going to be more inclined to listen to you. It would be like if you're taking financial advice from someone you don't know, or two people you don't know, one pulls up in a beater car and then the other pulls up in a Ferrari. Obviously, you're going to be more inclined to take financial advice from the person who looks like he is well versed in financial advice. So I think that obviously the look has something to do with it for everybody.
Yeah. Yes, I certainly want you to question things that come up, especially in my field. Spinal hygiene. What is spinal alignment? Why is it even important? Is it important? And I wanted to take an analogy that's super pervasive in what I do already, and it's pervasive in what you do, which is personal training. Someone wants to build muscle. You have muscle on you. You have a lot of muscle on you. You're also very lean. Maybe not to his standards, but he's lean. And he's been on stage. He has plenty of experience there. People can look at a photo of you, or they can look at you, and they can think, oh, you're healthy. You definitely know how to put on muscle. Because even though they've never, let's start with someone who's never put on muscle before. You can't transfer that experience to them. They don't know how to put on muscle, but they see you with muscle. So they're going to believe that you know how to put on muscle. I cannot, but why do they believe that is because they see it on you.
Yeah.
So transferring that into what I do, they took some level of blind acceptance. That's where I want to start. They took some type of level of blind acceptance. Anyone can come across when you don't have a basic fundamental root of knowledge that is in coherence or in agreement with what the other person's saying. That fundamental knowledge isn't the same, then you're gonna be skeptic and you're not gonna trust what they're saying. And they're gonna, if they're selling you something, then they're gonna look like a salesman, or they just want X, or they just want money, they just want, I don't know, whatever the heck it is. That's what they want, not what you actually came to them for.
And I think that like that was something that you and I have talked about in the past with me. Was one of the things that when I was starting to build like my training brand, so to speak, that I had like an internal conflict where I knew what I was doing and I had an unfathomable amount of conviction about my skills as a trainer. Like I knew if people would buy into me, they would get the results that they want and then some. You know, like I had zero doubts. But what I did is I felt almost like an obligation to validate myself to other people. So if there were people that would say, you know, I don't want to pay for personal training with you because it's too much money, or I don't know if this is a time commitment that I'm willing to make because it seems like an awful lot of time.
Yeah.
Where I always wanted to kind of go into the nitty gritty and explain so much detail and try to show them how that value was going to be provided. And since then, I've kind of backed off. And I think that, to allude to what you mentioned earlier, the reason that I was able to back off was experience. Like when you build a caseload of, hey, this is how many people I've helped, likewise with yourself, this is how many people you've helped, that's one way that skepticism can kind of like start to crumble because they see it with other people. So they're like, oh, well, he has this person, and that person that he helped, so I'm sure that he can help me then.
Yeah, and it's not just experience, because you can be very well experienced. Like just a year ago, I still had thousands and thousands of patients under my belt, especially with the clinic I worked at in Washington, in the state. Thousands and thousands of patients being healed from diseases and conditions that you are told are not curable. And it is against our licensure to state that we heal or cure anything. Okay. Which is basically flat out, it's just law that you've got to abide by. Okay, because that's how we are licensed, and we're not going to go into those details. Okay, but it doesn't matter that you can't legally say that if you have a patient that has absolved or resolved that in a capacity that defies what they've been taught, and you have tons and tons and tons and tons and tons of those anecdotal patients, your confidence, your conviction, your understanding goes through the roof. And when you see that the only patients that usually fail are the ones that don't follow through, then you're beyond unshakable. But here's the thing: if you do what you said, and this is a year ago, I still had those results. But I got to the point where I learned that I've got to hold the line. Yeah. Okay, you've got to hold the line. You cannot go past 50-50. I'm going to present everything I'm going to present to you. I know for certain some of the things that I say that cannot be refuted. If I take an x-ray of you, and we talked about this last couple episodes, take the posture pics, I show you what your posture looks like externally, we map that and coordinate that, or use coordinates on digital x-ray analysis with your actual x-rays. You have instability, which we'll get to in a minute. You can't argue that. Like, that's exactly what I'm going to send over to your neurosurgeon and say, this person is a candidate. This person is a candidate for surgery. What do you think? Should we do a less invasive thing first? Should we do true spinal correction first? Or what's going on? Like, if you have a scoliosis that's greater than 50 to 60 degrees, depending on the surgeon, 60 degrees is like absolute surgery now. 50 degrees is like, you should probably really think about surgery. In fact, we should probably do it now. But that's up to a clinician's advice. Now, let me ask you, if we know what 90 degrees is. Here's 45 degrees. If your spine's like this, do you think that you're still going to have horrendous health problems at 45 degrees, let alone once you get to 60 degrees or 50 degrees? You're going to have hell of health conditions just a few degrees off.
Yeah.
We've discussed that already.
Yep.
In fact, millimeters off. In fact, millimeters is what they use for surgical, is what they use to determine surgery. And you have to go through a series of less invasive attempts at correcting failed attempts to be even allowed to get a surgery. One of the things I show people, or people tell me, I was just talking to one of my friends recently, and she was like, "Oh, well, when I need chiropractic, I never have actually needed it, but if I ever need it, I'll let you know." I'm like, that's not how this works. And I can understand why, because it seems to be in the public's eye that it's all about pain, but it's not. And that was what I wanted to present today is I don't even think it's out yet, but I had access to it because of my colleague who actually did this study, and it is in the Journal of Radiology. Over 300 children, asymptomatic, had spinal instability. Or the study was on 300 children. There's a certain breakdown of percentage of which ones actually had spinal instability. I believe roughly 50, somewhere between 40 and 50% had, might have been 30, somewhere around there. Don't quote me on that. You can see the article later. Had greater than 2 millimeters of instability already.
Asymptomatic.
Asymptomatic. Okay, or regardless, they had that. And how many times do you hear people say, well, I guess maybe you don't, but I do all the time, is, well, why would you need to adjust a child? Well, have you ever watched some of those TikTok or YouTube videos or GIF animations? You have, where kids are doing the craziest shit, and then they just like fall and smack something in their head. Okay, children fall thousands and thousands of times a day. Okay, this is one of the best studies to elicit and to show that there is spinal damage, and this is like, it's irrefutable. And one of the reasons there's not more studies like this is because people throw up the flag of like, well, why would you x-ray a kid? Well, there's no need to. So if we actually did things like we were supposed to, like real doctors, and actually x-rayed these children, we would see that there's so much more going on, instead of just waiting till you're 40 years old and then getting your spine evaluated. Like, what if you didn't brush your teeth for 40 years? They would not look good. Or what if you waited till your teeth were in pain to brush your teeth?
Yeah.
Okay.
Too late at that point.
Don't wait till your back is in pain. And that's like one of the last things to show up.
So,
but anyways,
I know that the answer for this is probably, everybody at any time. But let's kind of give like some tangible takeaways here.
Yeah.
Whenever you have people that we've kind of identified that for chiropractic care or any type of like health intervention, pain should not be the red flag to go in. It needs to happen sooner. So if someone says to you, okay, I don't need chiropractic care because I'm not in pain, and you'd say, well, the necessity of that can come long before the pain manifests itself.
If it even manifests itself.
It's true. Because you
grab that real quick while we're talking.
This one right here?
Yeah.
Okay.
But continue.
So if you have, an asymptomatic individual and you tell them that it's not predicated on pain when you should come in, it's before that. And again, I know that the ideal answer is probably every person at any time.
Yeah.
But how do we figure out who is a good candidate for chiropractic care, when they should go in for chiropractic care? Or is it just kind of one of those things that everybody needs to try it first in order to get more of a baseline of where they're at, because you don't know what you don't know?
You hit this threshold, so to speak, that you definitely know you should get checked out.
Okay.
I'm going to give you ones that are before that threshold as well. If you are not, number one, you should be putting this goes to spinal hygiene, which we'll touch on later. We'll actually grab some models of spinal hygiene kits. If your spine was healthy, these are the things that I would have you do every single day to keep your spine mobile and the joints moving properly. Okay, so if you can't like turn a certain variance, okay, and part of this comes down to me training the trainers.
Yeah.
Right? Like, I need to be in every gym and train every single trainer on how to analyze your athlete, your client, on what is a muscular problem and what is a structural problem.
Yep.
Okay, that's a good foundation. If you're not able to achieve full range of motion in any coordinate, automatically, that's a great non-pain, non-symptomatic way to evaluate. I need to be checked and evaluated. There's no reason you should not be able to turn the whole way. And
I'm actually going through that myself, not necessarily with the neck, but I kind of have some like firsthand experience with this in the here and now. That I've been trying to do a straddle split for the past 2 months. It's something that I've been working towards. Just a cool goal that I had set for myself that doesn't really have any purpose. I just wanted to set a short-term goal and try to achieve it by a certain time. And one of the issues I was running into was a lack of progress once I hit a certain spot. Yeah. So continuing to try to force round peg square hole. And one of the things that needs to be analyzed, especially with a straddle split, but any type of movement stuff, is the structural thing.
Yeah.
So like, am I not able to do this straddle split because my legs are tight? Like, oh, my legs are tight, because that's what people say. Oh, I can't touch my toes, or I can't move here because I'm just tight, which in and of itself could very well be a neurological problem, obviously. Yeah. But then beyond that, it might be a structural problem. Maybe it's like a morphological issue. So I think that sometimes trainers, and I can speak, again, firsthand experience, I'll kind of poison my own well, so to speak. Sometimes trainers can get overzealous with thinking that they can fix everything. Like if someone can't move a certain way, they say, oh, we just need to do these stretches and you're fine, or we need to strengthen this, or do this coactivation or whatever, and you'll be good.
You there?
Please.
That's something that I just got in a very big, very professional debate. One-sided professional, being that the other side, pretty much, you still have trolls in the field of doctors as well. And I won't call out the name of the doctor here, but needless to say, he's very well known for just unabashedly saying things. He thinks you can correct structural issues, specifically forward head posture. But we'll use your example with exercises. You cannot do that. You absolutely cannot do that. But he went as far as to show me some studies, and I appreciate that. I appreciate the fact that he actually had studies to back up what he was saying. First off, which is where you can actually have a professional debate.
Yeah.
Okay, and it is possible to have a professional debate, and at the end you both see the evidence and still disagree. That is human. That is perfectly normal. And in this culture, in this day and age, no one has respect for people. Okay, I respect that he had all those articles. Here's where he was wrong on that. He used all these studies. And he also shouldn't have been so, let's say, joking around about it, or arrogant about it. But all of his studies, and I had them prepared for today, but we don't really need to go into them. They all, right away, I first off, I went and I indexed them and I actually read the articles. Okay, I know he didn't read at least one of them, maybe all three of them, because you have to pay for them, and I have an ability to get access to those. But I guarantee he did not pay for those. Okay, so that's number one. Read the actual article. All three of them reference CVA, cervical vertebral angle. And what that is in external, how many times have we talked about external posture not being the most important thing? External CVA. Okay, so it was the angle of the forward head posture based on external measurements.
Okay.
So it would measure down here about C7T1, and it would measure the base of your vertex. Okay, so that can change, and you can appear to have corrected forward head posture. But if you still have a spine or a neck that has a reverse curve, and all you do is pull that curve back by way of strengthening, let's say, the thoracic muscles, your curve is still reversed. You're still screwing up the signals and the cord within that spinal cord. You're still tethering that, okay? None of those studies had x-ray. So you can say forward head posture was corrected, but what is really forward head posture? We're talking about structural. We're talking about the neck. So off of my tangent, he was completely wrong. Okay? He was wrong in the fact that what is the purpose of even doing this forward head posture stuff? It's to look at overall health. in my opinion, my definition of forehead posture is not one that you can see externally. It's going to be measured on radiographic imaging so that you can see what's actually going on.
It's like when you say posture versus true posture. True posture being the structure, posture being what it looks like externally. Like, do you look slumped over? Is your head look like it's forward? Versus the true posture being what you can physically see on like an X-ray.
Yeah.
So you need like the imaging done.
Yeah, actually, absolutely. So quick on the spot quiz for Dr. Charlie here.
Oh boy, honorary doctor.
Honorary doctor. I was just gonna say that. Whether this is actually a herniation, we won't get into that or not. But we're gonna say this is a herniation of the disc here, and you can see all kinds of advanced degeneration with all these bony landmarks here, which is very severe.
Okay.
With disc degeneration this severe, what percentage do you think of people that are walking around with this have any pain?
So we're talking herniation aside. Let's pretend that this is not herniated. We're just looking at the vertebrae.
No, we're going to pretend that this is a herniation.
Oh, okay.
What you can see is the disc here. Hopefully you can see that on the on the camera, not the X-ray. You can see that you're supposed to have a nice healthy outer disc here, and then you have the disc has actually protruded and extruded into the canal. So this is where your spinal cord is supposed to be. You can see that it's going to put pressure on the spinal cord that's within the canal. You've only got so much space, and so that that herniation's gone into the canal now. So it's actually physically compressing the spinal cord, or at least we'll say that in this example, because that's what happens with herniations.
So what percentage of people who have like some disc degeneration, a herniation possibly going on, do I think have pain?
That actually have a herniation, and you would, and we won't say that you would or would not see it on MRI, because even MRIs miss it.
If I had to guess, completely unknowledgeable about anything in that regard.
Yeah.
I would say probably 75% have pain, and I would say 25% do not. And the only reason I'm saying 25% don't with a herniation is probably due to lifestyle not being conducive to like experiencing that. So like if they don't exercise regularly and they sit all day at work and they sit all day at home, they're probably not going through a ton of extension and flexion where they would aggravate that any worse or feel it at all. So I would say probably 75% have pain.
I like your analysis there. Depending on which medical literature you read and which medical textbook you read in your pre-med or your medical studies, it's about 50%.
Okay.
That's just a blanket number. It's not a blanket number because it has very good origin. Damn it. About 50% of people, depending on the research that you read, the medical literature that you divulge in, and the expert that you read from will tell you that about 50% of people with a complete herniation even feel it at all. That does not mean, however, that they are not experiencing health issues or other types of symptoms. That is just purely pain. But
Gotcha.
they're not going to know. You don't know what you don't know. How many times did we talk about that last episode or the first episode? You don't know what you don't know. If this is in like your thoracic cage, you're not going to recognize that your functional lung capacity is lowered. Especially, that's why I liked how you suggested that only maybe 25% of people don't feel it, because people aren't putting their body, they're not challenging their bodies enough to see this limitation.
Yeah.
If you only lost 10% of your lung function, I shouldn't say only, but if you lost 10% of your lung function, an elite athlete's going to notice that because they're having breathing issues or they're not able to run as fast. But no one else is going to know that.
Yeah.
Because they're not challenging themselves. So that's why I asked the question about herniations.
Cool.
So,
speaking of questions, let's get to some listener questions. So this week, Eric asks, what can I do to help my spine at home? Do I need to see a doctor? I think that's a good question. As far as the doctor stuff, kind of defer to you, obviously, because that's a question that's right up your alley and obviously probably posed to you specifically. So does someone, I mean, that's where you got to kind of figure out what the definition of need is, but does he need to see a doctor? Or the things he can do at home? Where do you kind of start with that stuff?
That's a good question. It kind of ties back into what we already talked about. Can you grab?
I can't.
The spirometer.
The spirometer.
Actually, grab all those. Grab the spirometer to the health. So these are some of the objective things that I was alluding to earlier that we didn't talk about yet.
Got a lot of gizmos and gadgets
I do.
over here today.
And this is the extent. I'm showing this also because I want to show you that as you go through care, I'm going to show you the medical literature. I'm going to show you can talk to patients that are in the clinic that have experienced these things, okay, that have healed from things that they didn't even know they had, okay? We're going to take functional lung capacitance tests.
Okay.
Basically, you're going to breathe into a spirometer, and we're going to track that. And you're going to see that if you're having problems with that and it's related to your spine, AKA you've lost the structure of your spine, or we find that there's instability in your spine, or as we're going through the exam, your range of motion is screwed up. All those things together paint the picture that your asthma, your allergies, your functional lung volume that is completely decreased, especially for a 20-year-old athlete or a 20-year-old period, and you're not even meeting normative data, or with heart rate variability, or with blood pressure. Anytime those things are off, start with the spine. That's the easiest thing to fix. Don't go on blood pressure medications, okay? Talk to your doctor about blood pressure medications. There's the disclaimer. But first, check the structure. Check the power, the life source that gives life to and controls your lungs, okay? We have a... So that was a quick answer for that guy, Eric. If you've never had your spine evaluated, you already know my answer, right? I'm going to say yes.
So yes, you do need a doctor.
Go do that, okay? There are things you can do at home. Getting you equipment like this, you can either take it at home and actually use this heart rate variability monitor. It also monitors pulse ox, and you can track this stuff over time. A lot of companies are doing that, like Whoop or the Aura Ring, tracking your sleep. It all comes back to heart rate variability. Sign up on the email list. That is also the same way you enter to win the free books and the supplements and the giveaways, is the same list that's going to enter you into, we'll send you an email that has this little guide, a flyer and a guide that I put together on heart rate variability. It's really cool, and it talks about a lot of the research that's being done and or has already been done for decades. It's just not well known by the public. What else Eric can do? Perfect tie-in to, I did bring all the spinal hygiene kit stuff today. If you have a healthy spine and a healthy structure, these are what you need to do to keep it healthy.
Okay.
Right? My goal is to work with people that can identify the structural issues. I'm going to be the best to do that for x-rays, etc. The trainers are going to be the best to do that when they're trained to understand what's not muscular, but what is more structural. Remember, muscles are dumb. They listen to the nerves.
Yep.
So worst case scenario, always think nerve issue, not muscle issue, okay? So when the athletes have a healthy, nice, normal structure to their spine, just like when we started working on Charlie, at what point did I introduce this stuff to you?
Day one.
Day one.
Yep,
right?
day one.
Because I want to start to train you. As we adjust you, you're going to hold your adjustments.
And to be fair, it was like minute one of day one.
Yeah.
Where I walked into the clinic, did my paperwork, and then after that, he was like, hey, showed me this, explained what it was, this wobble disc here, and then said, get to work. And you were actually, there modeling it for me, not just explaining what to do, but physically showing me how to go about my spinal hygiene and my different turns and twists and pelvic movement and stuff like that.
Right. If you did healthy, if your spine was already healthy from birth, because you should be getting checked at birth. That's one of the most traumatic places, especially if it's C-section or forceps or something to that effect. And the fact that kids are falling all the time. We just talked about that research article, didn't we? If your spine is healthy as you develop and age, this is pretty much all you need to do to continue to maintain it. Short of you're falling down and you're an elite athlete, you're going to need to get adjusted to keep your spine and maintain it. But this is imperative to it, okay? So we got wobble disc. That's something you do, go through certain ranges of motion. Can you hand me the, show me the dental rolls, or grab them both. So these are, once you take your x-rays, if you're prescribed these, you may or may not be prescribed these. These are called dinner rolls. They're gluten-free dinner rolls, okay? So this is shaped and modeled after the actual ideal curve of your cervical spine.
That looks familiar for me.
Yeah. He may or may not have one of these.
That I have to use on a daily basis.
Yeah. And so it doesn't feel great the first couple minutes you start to use it, but it's not supposed to feel great. It's supposed to help remodel your spinal structure. and put your neck and your spine back in normal anatomical alignment, along with the adjustments.
Yeah.
Those get the joints moving properly. This helps mold the ligaments, which is so key. How many times we talk about ligamentous injury? This one would be for your low back. Now, depending on what your x-rays show, you may place it like this, or it may be more of a thoracic area of the thoracolumbar dysfunction, and you may need it to be placed like this, but we'll show you that, and you may not need it at all.
Now I have a question about those two
Yeah.
that Eric may be asking, or some of our listeners may be asking at home. So since those are norm referenced, right? You said they are based on anatomically what's considered to be the ideal healthy spine.
Correct.
Since those are norm referenced, then everybody should strive to have the ideal healthy alignment of the spine.
Absolutely.
Do they need prior imaging, even though it would obviously
Yeah.
be better and beneficial for them? Is that a necessity that they have to get imaging first, or are those something like, even if I wanted to get started right now before I get in to see a chiropractor like Dr. Ryan, who I trust and that I feel comfortable going to, if I want to start right now, am I able to order those and use those immediately, or should I wait until I have the imaging first and then see if they're necessary or what have you?
Yeah. For those specific things, absolutely, you need imaging.
All right.
And bend it like this. Okay. So let's say your neck looks like this, and we need to remodel your neck. So you need to place it here so that your neck bends that way.
Yes.
If we place it up here, you're gonna screw up the rest of this curve here, but only fix. Well, you're not fixing this, but you're gonna. The point is, you put it in the wrong place. Your neck's going to mold along with gravity. No.
So everybody could use that and will benefit from it regardless,
Potentially.
but it's just a matter of where you're placing it and how to properly use it.
Yeah. Here's a perfect example of when you wouldn't do it. I've seen people come in with perfect cervical alignments. However, they've got so much forward head posture, back to that doctor we talked about before, so much forward head posture that if an untrained doctor of chiropractic, any doctor, untrained in expert spinal biomechanics, were to see your x-ray, they would say that you had an unhealthy neck because it was so far forward.
Because it looks like the posture is
Right.
forward. Okay.
However, that is true. You have forward head posture, and that's crushing the spinal cord and causing a lot of damage. It's not so much doing it up here, although it is tethering that area of the spinal cord. The damaged and injured area is coming from your thoracic cage. So what we need to fix is not your neck. So you would not need a Denner roll for your neck. In fact, that would worsen it. That would just push your head further forward.
Makes sense.
Makes sense. So you would need something in the thoracic region, which we also have those. I didn't bring it with me because they're much. Those contraptions are a lot more medieval looking.
Gotcha.
And, yeah. But that's a great question. Yes, you need imaging. Are there things you can do right now? Absolutely. That's the spinal hygiene stuff. And the stuff we talked about last week, or maybe it was the week before, when we talked about the pillow.
Yep. CBP pillow.
The CBP pillow. Or roll up a towel, tie it really tight, and put it under the mid part of your neck, not the back of your skull, because you're just gonna cause worsened posture. Okay. Or a pillow under your low back to help accentuate the normal healthy curves. Is that going to fix anything? No, but it's at least going to help take undue pressure off.
Yeah.
Hopefully that answers the question.
And probably, I would assume, it's going to help or stop the problem from getting worse. So it may not get you
definitely
back
the
to
goal.
normal, but it's going to stop you from worsening your issues until you're able to see someone who can readjust you and put you where you need to be over time.
Yep.
Okay, cool. So what is this thing? You brought all these gizmos and gadgets, and I see this bad boy, which I asked that rhetorically because I know what this is, but could we explain to other people what this is?
So there's a couple ways you can hang it on the wall, but this is for the upper cervical region. This is what I use for part of my spinal hygiene. There are not even every CBP trained chiropractor agrees with this, but I do. I like it for various reasons. I won't go into the minute details. This does sort of fall into the something's better than nothing category.
Okay.
Again, disclaimer, I could spend like 8 hours talking about exactly why I choose to use this. And then you only get to take this home once I feel I've watched you enough and you've showed me enough times that I believe you're going to do it correctly at home. Okay, you don't always use this metal one. This is the thing I brought. But this goes over the door.
Okay.
And then you put your head in here.
Uh-huh.
And
Would you like me to demonstrate that?
I don't know how we're gonna do it here. We'll do it on another video. Actually, I already have videos of it. So you guys that sign up for the email list and the giveaways and all that stuff, I actually have in the file that you get is the Spinal Hygiene, or all the Spinal Hygiene videos actually, and they're already on YouTube and they're already listed.
Awesome.
This is one of them. You'll see how to use it. But you put your head in it and then you completely relax your back and use your legs to basically distract the vertebrae in your neck and help pull you back in a normal healthy curve. But yeah, the specifics on that are on the video, and we will eventually shoot all these videos again later in much greater detail.
Perfect.
Hopefully that answered your question.
Yeah. Well, we always like to kind of conclude these episodes, these brief podcasts or talks or chats or whatever we'd like to call them. Coffee, dinner dates. We always like to conclude these with some actionable steps because, we've used the analogy before, like when I would go to coaching clinics, that I want to hear something, at least one thing that I can take away and implement. Yeah. So we always talk a lot when we have these, and we go off on different tangents and we give people a lot of usable information, but sometimes it's difficult to digest for people. So what are some like key takeaways from today, or some actionable steps, as we like to call them, that people can take home and people can implement right now to be healthier or to live a better life or to get more involved with us or what have you?
Okay, perfect. Get your butts signed up for the giveaways, because they're giveaways and they're free.
I like free stuff.
And once you get into that, you become part of the culture, and I promise you we're going to continue to deliver massive value. You get into that, you're going to have access to all the Spinal Hygiene videos. So we talked about that. Great takeaways are, you've just got to become aware of the spinal hygiene. Okay, posture. You're going to be so much more in tune with your body. It's going to be phenomenal, and you are going to be healthier just knowing what to be aware of. Things you can't really do. I mean, you could buy one of these, but these are all objective things that you want to know from your doctor next time you go in. Okay. We can get you heart rate variability monitors for those that are obsessed as we are. And you can track it. You can send it to me every couple weeks. Check it. You can know what your blood pressure is. This is just like good stuff to be aware of for health. Don't wait until you're, you know a bunch of the things you don't want to wait for. If you're having headaches, migraines, those are not normal. They're common. They're not normal. You should not have those, especially if you've had them for tons of years. Get your ass checked. If your blood pressure is high, get checked. If you're not going to really be doing this unless you're with me, but if your lung function is off for your age range, get checked. Those are some good takeaways. Energy, fatigue issues. Those are obviously if your posture's screwed up and you know it, like your friends always joke about your posture, or you just know that you're always like this, or you're doing a lot of text messaging thing, get checked.
Yep.
Those are sort of actionable, more like awareness steps. Drink some green tea. Great, extremely healthy, beneficial for you. Charlie was talking about that last week. Some of the nutritional things you can do. Start implementing those again. If you don't know what they are, go watch last week's episode. Another takeaway are the research articles that we talked about this week. Exercises do not fix your spinal structure. They do not do that. We also talked about last week the diagnostic imaging that we use to prove that. We show you that through both X-ray imaging and DMX X-ray, which is a video X-ray, that the exercises do not correct structure, and how not to improperly perform those exercises. More takeaways. Get yourself a spinal hygiene kit. If you're one of my patients, you've already gotten it. It's part of signing up for care. Any questions you have, ask us. Let's see, what else is there for takeaways? All right, I guess that wraps up this week's episode. Subscribe, follow our Instagrams, which we'll put in the corners again, as usual. We've got No Excuse Charlie, and we've got Dr. Ryan Livingston. Oh, stay tuned for we are going to be launching an integrated group. We're not sure if we're going to do Facebook group or a LinkedIn group. LinkedIn's a lot more professional.
Maybe we could have people give feedback on that.
Yeah, so there's an opportunity to give feedback. But the group will have a lot of benefit and value. We'll be posting the episodes on there, and we'll also be posting the files, the giveaways, all kinds of stuff there. So it's one centralized location besides a website that you can go to. And you can actually interact with us as opposed to email, which is fun too. But I guess that's it.
Cool. Thanks for joining us again for Coffee with the Doc. I'm Charlie. And this is the Doc.
Ryan Livingston.
The Dr. Ryan Livingston.
The Dr. Ryan Livingston.
And we will talk to you guys next week.